Welcome to the Feds, insiders bringing accountability, integrity, and reform to a broken bureaucracy. At Feds for Freedom, we value constructive dissent and healthy debate. The views and opinions shared in today's episode are those of the speaker alone and do not express the views or opinions of the U.S. government or any other employer.
Welcome back to this week's episode of The Feds, where we seek truth. I am Stephanie Weidel. Go ahead and before we begin, click the like button on the episode and the channel. And be sure to check out our new and improved website at fedsforfreedom.org. Today, I am joined by Lucia Sinatra, a retired corporate securities attorney who co-founded No College Mandates to help end college and university COVID vaccine mandates and to offer free public resources which have helped tens of thousands of students and families make the most informed decisions. Welcome, Lucia. Thank you so much for joining me today.
Morning, Stephanie. I'm so happy to be here. Thank you.
Well, Lucia, you are the co-founder of No College Mandates, the organization that worked tirelessly to end the COVID-19 vaccine mandates for colleges and universities. What led you and your co-founders to take the lead on this very important issue?
You know, like most other mothers that become advocates, basically, I consider myself an overnight advocate in this realm, in this space. I had two prospective college students in the spring of 2021. They were about to go. One was about to go to college in the fall of 2021. One was about to go to a community college and do some extra courses in order to get himself to college sort of the next year or two after. And when I saw the mandates being announced at the college level, and that happened in April of 2021, I thought, this doesn't make sense. I don't think we have enough data for them to mandate these vaccines. And it just became this huge slippery slope. One or two colleges announced COVID-19 vaccine mandates, and thousands followed suit. And I thought, oh my God, I need to jump in and sort of see if they're really analyzing the data, if this is really necessary. This is such an extreme, measure in my mind, that to mandate a medical treatment, removing informed consent, removing medical freedom, the situation has to be so dire. And even then I question whether it's an appropriate thing to do. And I just wasn't seeing that, Stephanie. And that was my big wake-up call. And I thought, my kids are going to be subject to these mandates, might not even be able to go to college if they don't take these vaccines. So I need to do something about it. And that's what inspired me to start this work.
So where did the mandates ultimately come from? What was the incentive to even mandate it?
Yeah, it's a great question. It's hard to know the exact answer. However, we believe that the mandates came directly from the White House. For this exact reason, Stephanie, there are 20 million college students in the United States. When COVID-19 vaccines were coming on the market, you likely remember, like everybody else, public health officials saying, everybody get vaccinated. The goal is to get a vaccine in every single arm. Well, that's a huge amount of the population. If you get 20 million college students on board with taking these vaccines before they go back to in-person learning, that's huge. So there's a group called the COVID Collaborative. And the COVID Collaborative is a bunch of government officials, higher education, presidents, and they all came together and wrote a letter. I believe the letter was written by Jerome Adams. They all signed the letter, probably about 30, 40 signatories to this letter. And it basically went out to all leaders in higher education. And it said, in no uncertain terms, we got a real problem on our hands. You need to make sure your students take these vaccines, and you need to have programs in place, policies in place where nobody, can really reject what you put into place. This is so essential. This is so important. So basically, go back to your college communities, figure out a way to make these things mandatory or to heavily coerce your student population to take these vaccines. I'm summarizing that this is pretty much what the letter said. Shortly after this letter was sent to all leaders in higher education, within a few short months, the White House posted on the White House website the College COVID-19 Vaccine Challenge. Well, this is exactly what you think it was. It was colleges sign up, they participate with the White House by getting tools, getting strategies to basically roll out to these college communities all the reasons that they have to take these vaccines and that they cannot turn this down. Like, we've got to get a shot in every arm. I mean, we've got emails, Stephanie, through FOIA requests. I mean, colleges, no joke, we're shooting for 100% participation in the COVID-19 shot campaign, no question. So not every college signed up for the COVID-19 vaccine challenge. All of the elite colleges did. And basically, once they signed up for the challenge, they were in communication with the White House about how they were doing getting their population of students vaccinated. There's an organization called the American College Health Association. They were directed to create the marketing materials to sell these vaccines to the students, right? Because as you would imagine, students are busy, they don't have the time. They're like, well, why do I need to do that? Um, so they created toolkits for colleges to use, college health centers to use, so that when a kid came to the college health center and didn't have a COVID-19 vaccine, they had all this propaganda that they were told to feed the student. And it was crazy propaganda. So what they did, and then they paid college influencers. One thing I'll add, I'll slow myself down just a little bit. The American College Health Association is funded by Pfizer and it's funded by the CDC. These are their two biggest funders. Yeah.
I'm not
So
surprised.
not surprised. So here they are writing these toolkits, paying college influencers, like at the historically Black colleges and universities. They're called HBCUs. They were paying college influencers to take these toolkits, Stephanie, which said, just take the vaccine. You've gotten every other vaccine and you were fine. If you don't take this vaccine, you're going to infect your family. You're going to kill your grandmother. These have been 100% thoroughly tested and vetted, these vaccines. They are 100% safe and effective. And I could go on and on and on with the lies that these toolkits were fraught with. These are the people that are going out on college campuses lying to their population just to get a shot in every arm.
Mm. So they came from the White House. The mandates came from the White House. Do you know how much money they were offered for compliance, if any?
So I believe everybody got CARES Act dollars, and I've seen one or two of these contracts through CARES Act, through FOIA requests. Colleges, I believe, were really at liberty to use those CARES Act dollars as they saw fit. My guess is a lot of them hosted their on-campus COVID-19 vaccine clinics. A lot of them put up posters. A lot of them put out marketing materials, hired a COVID team, a COVID task force. My guess is they used that funding for those particular reasons. They used it, I would guess, they used it to heavily push the COVID-19 vaccines and to host these on-campus clinics. Payment beyond the CARES Act, we haven't found any FOIA information, and we haven't had that many lawsuits, to be perfectly upfront. So there could have been additional incentives and additional payments. Like, for example, I mentioned the HBCUs earlier. They got an extension on keeping their CARES Act dollars. So some of those HBCUs held on to the bitter end with their COVID-19 vaccine mandates, which means they were one of 15 colleges that were still mandating these things up until Trump signed the executive order saying schools can no longer mandate COVID-19 vaccine vaccines or you're going to lose federal funding. And he signed that on February 15th. Up until that very day, like that very week, some of these colleges were still mandating COVID-19 vaccines. And I know for a fact, some of them were still receiving CARES Act dollars. And I don't think they wanted to give up those dollars.
Before we get to the executive order, I wanted to ask, what did the religious and medical exemption process look like in these colleges?
Great question. It was incredibly varied. Parents would call us, students would call us in a complete state of panic saying, "Oh my God, I just got accepted to my dream school, but I don't want to take these vaccines. What do I do?" So when we started our organization, we were working around the clock just to secure exemptions for students. And it varied from college to college, right? So their medical exemptions were very hard to get, very hard to sort of prove. You had a contraindication to the ingredients that were in the vaccine, or that you had a medical personnel, a medical doctor that was willing to say, "Yeah, this my client has, these issues, so cannot take the vaccine." Although there were some instances. An example is there's a private college where I live, in the Northern California area, called Santa Clara University. It's a private university. So private universities have much more leeway to make their own rules. They're not governed by federal law the way that public schools are, even by state law. So they've got a lot more freedom to say, this is what we're going to do. And if you don't like it, you don't have to come here. So there was an example of a girl there who took her primary series, had a series of adverse events, adverse reactions, had a couple of doctors write her medical exemptions because they then mandated the booster at this college. And her doctor said this kid, can't take the boosters. It could make her really sick. Like she just recovered from some adverse reactions on the primary series. The MD at that school, so there's an MD, there's a faculty MD who runs the health center at Santa Clara University, who is also a city official, a city health official, city of Santa Clara health official, and sort of a well-known pediatrician in the area. He called her doctors and he said, "You reverse and remove this medical exemption immediately." So this kid now, these doctors had to retract their medical exemptions. This kid now can't go back to school because they wouldn't accept religious exemptions. Especially, they are a Jesuit university, and especially for Roman Catholics. They would not accept religious exemptions because the Pope had announced we should all go out and get our vaccines. So we're not going to allow religious exemptions because the Pope just told everybody it's okay to take these vaccines. We should all run out and get them. So this kid now has can't go back to school. And there are examples like that all across the board, Stephanie. There were some schools that accepted medical exemptions. There were some schools that accepted religious exemptions. There were some schools that wouldn't even consider them and said, go somewhere else. And then there were some lawsuits along the way, and some that were positive and some that, that didn't win. So it was really all across the board. If we fast forward to today, um, or up until the executive order was issued, it was pretty easy to secure a religious exemption. However, medical students, everything I've just said, it's completely different when you're talking about healthcare students. They have a completely different set of rules.
And we're going to get to that in a little bit. So what routes did did your organization take to get these mandates dropped?
So in the beginning, I've never done anything like this before. I mean, we were just kind of poking and hoping, right? How the heck can we make an impact here? How can we end these? And so we did a lot of television appearances. We did Fox and Friends. One of my co-founders was on Laura Ingraham. We tried to get on Tucker Carlson. We got some of our students out there speaking about their stories. So when we started the organization, we had two primary goals. And the first was protect every student from taking these vaccines if they don't want them. So that meant getting students resources for medical and religious exemptions. And we were working on that around the clock. You know, um, we were getting requests from really all over the world at times, international students. What do we do? We already took these vaccines in our home country, but we're coming to the US and they want us to repeat these vaccines. And I thought, oh my God. So we were just getting requests from all over the world. We need help. We need help. So that was one, sort of our one big effort. And then our second big effort was writing to these colleges, calling these colleges. For one college who was so incredibly strict with their COVID vaccine mandates and then booster mandates and no exemptions accepted, we set up a phone line. We set up a phone tree. So what we did is we empowered parents to call the president's office every 15 minutes over 2 weeks to basically say, you need to end these mandates. They are unscientific. There was a boy in that community who suffered a stroke after his primary series. They were telling this boy, you can't have an exemption to the booster. You still need to get the booster if you want to come back to school. I mean, just crazy, crazy things. So we hosted huge letter campaigns. We did a line acts, we did petitions, we did phone trees. We did basically everything we could think of to put pressure on these colleges. And what we realized is the public embarrassment of getting on news shows, writing articles, that was working. That seemed to be working the best. It had the most reach, and these schools did not want to be called out for these unscientific, unethical policies, especially when other schools didn't have these policies and they were doing just fine, or other schools had dropped these policies. Then you could really embarrass an institution by saying, they're not, we already know these vaccines don't protect against transmission or infection. Look at all these other schools that have done so well, either without mandating COVID-19 vaccines or after having dropped COVID-19 vaccines. So they cannot give us any rationale for why they keep these mandates in place. So that seemed to work the best. And that's what we continue to do to this day. Other than, and we also reached out to the federal government. We're in touch with members of Secretary Kennedy's administration. They are very well aware of what's still going on for the college cohort. And then we reach out to state representatives. I've been in touch with state representatives from Montana to Florida to Texas to the state of California where I live. They're all very well aware of what's going on. The hard part, Stephanie, as you know, is getting them to elevate this to the top of their list, right?
How many schools still had mandates by the time that Trump signed the executive order in 2025? 15.
Out of almost 1,200 schools.
Wow. And so his executive order said, if you don't drop these mandates, we're going to defund you. And how many of them actually dropped them? All of them?
All of them. They dropped them. It took a little while, Stephanie. So, we had to call to make sure. And trust me, some of them were kicking and screaming. They were not happy, right? They were not happy. But they also don't want to face a lawsuit or loss of federal funding. So we called all of them. And within, I would say, 2 weeks of that executive order, all of their websites had been updated. It was all removed from their list of requirements.
What do you think their goal was to continue those mandates? What did you ever ask?
All the time. I mean, usually we get hung up on. They would tolerate our questions to a certain extent, and I empowered parents, grandparents, local community members just to reach out to these colleges and find out what the heck. And it was ideology. It was are still hanging on to the belief that these vaccines are protective to the community, and we're going to do everything we can to protect the community, like Bryn Mawr, Swarthmore. These are some ultra left wing liberal arts colleges in the Northeast that were holding on to mandates, and then some of the HBCUs because I don't think they wanted to lose their federal funding.
Wow, there's so much evidence out there saying this doesn't keep you from getting COVID. You won't necessarily have COVID even less. And in fact, you're you can get COVID so much more easily with these and you could be injured. And I mean, it's just we've talked about it all over this podcast. Yeah. Go
You know,
ahead.
Stephanie, I should have recorded some of my conversations. I sort of regret that. Oh, right. I did write Substack post about some of my conversations, and of course, I tweeted it. And I used to tell, some of my colleagues in this space, there's only so much stupid I can handle in one day. So I'd have to stop making these phone calls for self-preservation because I was basically going to lose my mind. I mean, if you could hear the things that people said to me, I mean, and like you, I just said, I will send you the data. As a matter, I'll fly there. I will read you the data. I'll do whatever I need to do. Oh, no, no, no. I don't think you understand. We're a community that's all about protection, and we believe that this is protection. And I'm like, yeah, but it's not. And it's already been admitted by the CDC, public health officials, you name it. Oh, no, no. It was as if they just couldn't hear that part of the conversation because
Unbelievable.
yeah, just kept repeating their nonsense over and over and over again. And propaganda is strong. It is incredibly, incredibly strong. I realize brainwashing and propaganda, I still don't know how to break that wall down.
Students are still largely required to get the COVID shots. How do the schools continue to mandate this for healthcare students? And why did the executive order not include those students and
Great
those colleges
question.
and universities?
Yeah, so it's I look at it as a twofold problem, Stephanie. I don't know if that's the right way to look at it, but the way that I see it and the way that most of us in this space see it is it's a twofold problem. Okay. So there are three tiers here, and this is another way I describe this. The colleges, and I call them general population college students, general population, non-healthcare majors. That's done. It's over. It's been over since February 15th, the executive order, truly over for all of those students if you're a non-healthcare major. Tier number two is you've got healthcare programs at colleges and universities that are still mandating. So that means it is a college, it is a school, and here's an example to create a visual. Let's say there are 135 medical schools in the United States. I don't know if that's accurate or not, but I think it's pretty close. There are about 20 of them, 20 of those medical schools that are still mandating COVID-19 vaccines, such as Johns Hopkins University, Emory University. I can't make sense of it, Stephanie, because if you enter Johns Hopkins as a nursing student, you are not mandated to take COVID-19 vaccines. However, if you want to enter as an MD student, you need to show proof of COVID vaccination prior to enrollment. Okay. So make that make sense. But this has been our whole entire trajectory over the past few years. Like I'm used to the idiocy of these policies, right? And I'm sitting here shaking my head at freaking out. And these administrators are like, I don't know why you're freaking out. This makes perfect sense to us.
Now, are they talking about the route for exemptions?
No, they will say on their website that they will consider reasonable exemptions. They will consider medical exemptions, which are still very hard to get because you need a doctor to say some sort of contraindication. And I think they will consider religious exemptions as well. That's gotten a little bit easier, but I'm sort of going to speak out of both sides of my mouth here. It's gotten a little bit easier, maybe at the school level. It really depends on the school, really depends on the program. And you are 100% correct. Under that executive order, we are waiting for guidance under that executive order from Secretary Kennedy and Secretary McMahon. That guidance was due within 90 days of the executive order, of which we are far past. We would like to hope and we are putting pressure on Kennedy and McMahon to include healthcare programs that are owned by, hosted by, run by colleges and universities are also the definition of a school, right? So those 20, 25 medical programs are a school. They are a school. However, in the past, healthcare programs have been able to claim exceptional status because they are a specialized degree. They interface with patients in clinical settings, and that's what makes them exceptional. because they are a different type of program that interfaces with the public. And you have to go through practicums to graduate. Every single healthcare degree from EMT certification all the way up to MD. You have to be in clinical settings with patients in order to complete practicums to graduate. So this is how they claim, we think, exceptional status. Now, is there a law that they have exceptional status? Not that I found. Is there case law? Yes. It's out there claiming that they are a school, but they can implement separate rules. They can implement separate policies because of the unique type of the degrees that they're offering. Okay.
Mhm.
But then, Stephanie, so let's say the executive order guidance comes out and healthcare schools are included. This is wonderful. This would be great. My job still would not be over because then these healthcare students get to hospital and clinical settings, which have their own set of rules. So, what I get called upon on a daily basis to help kids solve is my school granted my religious exemption. I'm a fourth year nursing student. I'm about to go into practicums at the hospital down the street. They will not recognize my religious exemption from my school. Therefore, they're telling me I have to show proof of COVID vaccination or get updated shots, or I can't step foot in their hospital to complete practicums to graduate.
And they're not allowing any exemptions, these hospitals.
That is not true. Some of them are allowing exemptions, and it's very hospital dependent. I don't know what their rhyme or reason is for accepting them or not accepting them. I've got several friends in this space, several advocates in this space that are successfully securing exemptions for healthcare students, religious exemptions. So it is possible, um, but I would tell you that the very large majority of healthcare students are still complying with the coercion because, for a variety of reasons, Stephanie, they don't want to be in bad standing in their programs. They don't want to be ostracized. They don't want any bad, they don't want to be labeled, that those are the students in the program that didn't take the vaccines. So I would say that we still have the large majority of healthcare students complying because it's just the easier thing to do.
Mhm. I mean, we're seeing it with the Veterans Affairs healthcare workers. They are still under a mandate to get the shot. So that has not been lifted for them.
Right.
It's absolutely disgusting. So what measures are you all taking to advocate on their behalf?
Yeah, so I'm in touch. So Trump's executive order has been taken up by a bunch of congressmen. Congressman let me see, Messimer from Indiana and Fluger from Texas. And they're basically taking that executive order and they want to turn it into a law. They want to codify that executive order, which is wonderful, right? This is a big deal. I don't love executive orders because, as we all know, they can easily be reversed. So I was in touch with their offices yesterday, explaining, basically the problem here that simply codifying Trump's executive order is not enough. It's not enough to protect all college students. There are loopholes that exist, and we have to close those loopholes. So they have promised me that when they get to committee, they're going to talk about an amendment. They've worked on the bill, they've got a draft of the bill. They're going to try to get an amendment to committee. They're going to see if they get to Congress floor. Will they get an amendment at that time? So we're going to stay in touch. I told them I can bring anybody to testify on behalf of this bill and why it needs to be broader. And so we're just going to stay in touch and try to work together to see if we can get everything included under this law. We could potentially write it so I hope they can potentially write it. This was my request yesterday, is not only college students and healthcare students at colleges, but learning programs, teaching programs at hospitals and clinical trial set and clinical rotation facilities. The thing that doesn't do, because I'm so focused on the student and I did that for a particular reason, Stephanie, which I can tell you about a little bit later. I needed to get attention around the cohort of college students because what was happening at that level was so incredibly tyrannical and oppressive.
Yes.
And when all other mandates started to fall away, they didn't for the college students. So we stayed very focused on our mission for that particular reason. People did not know. If you didn't have a college student, you didn't know how awful these policies were. I mean, to this day, I tell stories and people are like, "You've got to be kidding me." I had no idea that was going on. We knew the policies were bad, but we didn't know they were that bad. They
Yes.
were bad at the college level. And they still are for some healthcare students. So we just, it- the if they extend this law, write this law to include students at colleges within healthcare programs at colleges, but then also in learning settings at the hospital, well, then it takes care of the students. But what happens to the healthcare workers who are still subject to mandates at those
Yes.
facilities? It wouldn't end that.
Right.
So what I'm constantly grappling with is, do we need a second law? Do we need a second executive order where we can pull together healthcare workers, healthcare volunteers, healthcare students, any healthcare personnel whatsoever? Is the better way to go about this with a whole separate executive order? And that's what I'm trying to figure out with the help of these representatives, some lawyers that I've worked with, and what is going to get the attention of the Kennedy administration and get this to President Trump. What is the low-hanging fruit here? How do we solve
Yes.
this the easiest way possible?
And we're doing the exact same thing on the federal employee
Got it.
side with
Yeah.
those federal employee mandates. Now, how did you recognize those two representatives as the ones that you needed to go to about this? Had they already expressed interest in codifying the executive order into a law,
They
or
did.
did you reach out to them? Okay.
They did. I found them through a news article last week. I saw a news article saying that their offices were going to codify this, and I thought, "Oh my God, this is great! This is what I've been waiting for." Except it's got to be more broad. So I
Yes.
reached out to them last week, and we set up our first phone call yesterday. But I found it because they announced it to the press.
So, what other efforts are is your organization involved with now?
So, now it's not as crazy as it once was. When we had 1,200 colleges with undergraduate students who were freaking out about not being able to go back to school or not being able to graduate without these vaccines, things were crazy. Things have definitely slowed down. The majority of our work now is getting resources to healthcare students who don't want to take these vaccines. We're getting more and more outreach every week from healthcare students um, who are literally shocked that this is still going on and why am I
Yep.
still subject to this? And then reaching out to federal representatives under the Kennedy administration. We're still writing articles, public embarrassment, which we still find and X posts and trying to get as much information out there. Like, why would you go to Johns Hopkins Medical School when you can go to Harvard and not have to take a vaccine in order to enroll? But it doesn't mean you won't have to take a vaccine to go into a hospital. So we have to be really clear. It's very confusing to some people because, everybody writes in and says, it's over, it's over, it's over. And I'm like, well, it's kind of over. We still, so we're doing everything we can to interface with state representatives. We're also in touch with attorney generals in several different states. For example, Florida it is against the law. It's illegal in the state of Florida to require proof of vaccination for anybody, any business. They can't require that a customer, that an employee, that a volunteer shows proof of COVID. They're doing it anyway, Stephanie. They are doing it anyway. So there are
And
students.
what is happening to them? There's got to be accountability.
Nothing. Nothing
What?
is right now. And this is infuriating, right? So this is oh, when you have everything in place so that this is not possible, yet they're still getting away with doing this because we need the AG to go in and say, look, we've got the state law. We hear you're doing this. You cannot do this.
And has Latipo done that?
No. So I've reached out through several lawyer contacts to Latipo, to the new AG in Florida. I've got some emails into him. My emails get ignored. So now I've elevated it to lawyers that work closely with him. And I'm like, look, you may think this is not a big deal, but it's kind of a big problem. Like, they can't just keep mandating. So I was just looking at my Twitter feed because there's a hospital in Florida. It's called North Naples Hospital. So it's called NCH Healthcare System. They are still requiring that their students show proof of COVID-19 vaccination. Well, it's illegal, but yet I get phone calls saying, "What do I do?" And I'm like, well, at this point, you know, try to secure an exemption. Do not comply. You reach out to the AG. I'll reach out to the AG. Short of that, Stephanie, we can file a lawsuit. But that has been the hardest thing to do in all the years that I've been doing this work, to get college students to step up and file a lawsuit so we can actually make sure businesses, entities, hospital systems, colleges are following the law, or are held accountable for the damage they've caused, the injuries they've caused. And that's a very, very, very difficult thing to do.
I I can understand. Do you have statistics of how many students pushed back and never received the shot?
We don't. So, colleges used to have, and they deleted these real fast, once the mandate started to drop. So I would say by summer 2022, no, maybe by 2023, colleges used to have something up on their website called COVID-19 vaccine dashboards, or COVID-19 dashboards. And on those dashboards, you would see week by week the number of students who had COVID-19, the number of community members who had vaccines, the number of community members who had exemptions. You could find all this information. And schools ran these dashboards differently. So some schools would put out a ton of information, and other schools wouldn't give you, let's say, like the exemption rate data. So without FOIA-ing those colleges to get that information, the only thing that we could go by was these dashboards. My son is a senior at Dartmouth College, and he was an entering freshman. He was entering in September of 2021. And at that time, Dartmouth published that in September 2021, only 99 community members filed for exemptions. They didn't say whether they were all granted or not. Out of their thousands and thousands of community members, only 99 had filed for exemptions. So my son's religious exemption was fairly easily granted. They made it sound like it was going to be some horrible, scary process. He was going to have to interview. He was going to have to justify his religious beliefs. He was going to have to get a letter from clergy, all of which we were working on in preparation of having to defend his religious beliefs. And they just rubber stamped his exemption. And I think it's because they didn't get that many. If they were flooded with exemptions, I think the process would have been much more difficult. And then, that's completely different. Like, the Jesuit schools were absolutely horrible. All the Jesuit schools around the United States, they were really preventative with these kids getting religious exemptions. And that, as I told you, medical exemptions were really hard to get, but they wouldn't let Roman Catholics file for religious exemptions. So these kids either had to leave school or they had to comply.
For those who complied, how do you think the coercion of college students who will affect them as citizens in the future? Because most of them gave in and got it.
Yeah. Sometimes I think this is what this experiment was all about, Stephanie. Sometimes I think rolling out the pandemic the way that it is, and all that we've learned about the lab leak and about the protocols that were in place prior to even the pandemic, becoming a pandemic and the fear and the propaganda. Sometimes I think this was an exercise in compliance. This would, and for college students, I think that these colleges are looking for students who are compliant, and that this was a huge test in how much work do we have to do when the next event happens to get more people to comply. I even think with the healthcare system, I'm afraid. I'm afraid for the healthcare system, the future of the healthcare system, because they are weeding out the students who are the critical thinkers, who want to push back and reject these vaccines for truly scientific reasons, and they're completely ignoring the conversation, and they won't engage in the conversation, and they have no data or science to show that these vaccines are essential for these students, yet they have an incredibly compliant young healthcare student population. And these are the students they need to be leading the future of healthcare for the next event, right? They don't want the students who are going to think outside the box, think for themselves, come up with alternative methods of treatment, come up with alternative avenues for protection. I don't know. I think some of this was very purposeful on some of them. And I do fear that not enough students have learned enough to push back. Compliance, they made compliance so easy. They paved the road to compliance. The road to non-compliance was incredibly rough, incredibly rocky. You had to have very strong, very brave students on that road to non-compliance. And even the students that experience the road to non-compliance, I wonder if in the future they'll comply because that road was such a difficult one to travel. So it's a really scary thing to think about.
This is something that Feds for Freedom has gone towards in their education arm. We put together a conference at Liberty University
Yes.
in April called
Yeah.
Medical Freedom and the Constitution, Your Life in the Balance. And it was geared towards students just presenting the federal employee, military, and medical realms, talking about this is what government overreach looks like.
Yes.
You can choose differently,
Yes.
and you can choose a different path for your own health.
Yes.
And this is the kind of conference, this is the kind of message that these students need to hear, that there's a
100%.
different path.
100%. We need to somehow reverse what they've been told. And I do think these kids are smart. I've discussed a lot of it with them. I think it's multifactorial, Stephanie. Sometimes they just don't have the time, they don't have the bandwidth, they don't want to do the research. It's easier to comply. But I think we just keep delivering the same message of this what happened should have never happened. And if you just took a day, that's what I did with my son, right? If you just took a day to read the data and decide for yourself, I have a feeling you would not have complied, and you would have seen. So I did that with my son, who was really upset with me when I said, I want you to think about these vaccines before you just jump in and get them. And he said, well, if I don't take these vaccines, I can't go to, all my high school graduation parties. My friends won't let me over their house. I can't hang out in groups anymore. Like, Mom, you're ruining my life. And I said, well, then let it be your decision and not mine. So let me give you data on both sides of the argument. He's a really smart kid. And I said, and go do your own research. I said, I'll help you find the data, but you can find data on your own as well. And I gave him the Great Barrington Declaration. And then I gave him some studies from MIT and Yale that said absolutely everybody has to get these vaccines, but they were empty studies. They weren't backed by scientific data. So he went and locked himself in his room, came out 4 hours later, and he said, Mom, I will never take these vaccines. And I said, good for you. Now, what do we need to do about it? And he said, we need to file a religious exemption, and this thing needs to be rock solid because I am not taking those vaccines. And because he got there himself, he now understands the value of not complying with something that he never needed in the first place.
Yes.
I don't know if that would work on every student. I have told this story so many times, Stephanie, on podcasts. I've written about it. I've told about it on interviews, and I constantly get parents that say, "Oh my God, what did you send?" At the time, what studies did you send them? What did you say? That was my situation with my son. It doesn't always work with
No.
college students. They think they're invincible. Oh, it's a shot. It's just like a flu shot, mom. Nothing's going to go wrong. Everything's going to be fine.
Well, there's
Little
nothing
kids.
just with the flu shot. The flu shot in itself has major
Major,
problems. Then
major
then
problems.
I bet your son is starting to look at everything else now, starting to question everything.
100%. He'll never get another shot again, Stephanie, unless he sees data, that says they are effective and, the adverse events are minimal. I mean, we joke about it all the time. He's like, "Well, you're gonna be a fun grandma. My kids aren't gonna get any vaccines, are they?" And I'm like, "Nope, not if I have any say about the matter."
Same here. Good for you, Lucia. All right. I have one last question for you before we end. If the average American citizen could do one thing to combat the corruption that we see in our country, what would it be?
It's such a great question, Stephanie. I think that people underestimate the importance of their voices. When I started this mission, we had lots of parent volunteers on board, and they wanted to remain anonymous. They wanted me to be in the forefront, but they were happy to help me get my work done, whether it was write letters to colleges, publish an opinion piece in a newspaper article, reach out to colleges, even if you don't have a college student, but you happen to live in a college town or college community, or you see things going on at the state level that you don't agree with. It's still the state that you live in. And I think people really underestimate the value of their outreach, the value of their voices. I can't even tell you how many times I hear from students, "Well, I'm just one person, I can't make a difference." Yes, you can. This mission that we started, I was just one person. My co-founders and I came together. We were just two people, and we decided we are going to do everything within our power to end this. And so we just started using our voices, and then other people wanted to come on board and help us and add to our voices. So I would say reach out to state representatives, be vocal, publish an opinion piece in your local newspaper, national magazine, whatever you're good at. Because that's the other thing, Stephanie, is we all have different skills. We all have different gifts. A lot of people have a lot to say about what transpired in the past few years. And I just wish they would get those stories out there and say what they have to say instead of keeping it bottled up inside, which means it's going to die there. It's not going to be out in the public realm where perhaps we could, save this from ever happening again.
Yep, that's excellent. Thank you, Lucia. Thank you so much for joining me today.
Thank you, Stephanie.
Thanks so much for tuning in. Please like, comment, subscribe to, and share our podcasts. I'll see you next week.